Lung cancer. Take 5 minutes to get the picture. The lungs have a vital role. They provide our organs with the oxygen they need to function and expel the carbon dioxide that our cells release. Let's take a closer look at this wonderful machine. The air that we breathe enters through the nose or mouth and passes through the trachea before reaching our bronchi, continuing down their ramifications, the bronchioles, and finally reaching the alveoli. This is where the exchanges between air and blood take place. The oxygen crosses the alveoli's walls to be picked up by the red blood cells and circulated around the body. The carbon dioxide-laden air follows the opposite route before being expelled. There are 2 major types of lung cancer, named according to the appearance of the cancer tissue of which they are composed. Small cell cancers account for about 15% of lung cancers. They tend to occur more frequently in young adults without any obvious risk factor. Non-small cell cancers are the most frequent type and occur primarily in patients who have been exposed to tobacco. Lung cancer is the most frequent form of cancer, with more than 1 million new cases each year. Men are the most affected, but the number of women with lung cancer is rising. Lung cancer is the leading cause of death due to cancer in men and the 3rd leading cause in women. Cigarettes are responsible for 9 out of 10 lung cancers. That shows the vital role that smoking plays in the disease's development. The cigarette smoke that coats the bronchial walls effectively contains some 40 substances that can damage the cells and lead to their becoming cancerous. The risk increases with the number of cigarettes smoked and the duration of smoking, if one starts smoking at an early age, and above all, in the case of a long-standing habit. Studies show, moreover, that this risk is shared by the non-smoking victims of passive smoking, that is, non-smokers who live with a smoker or are frequently in smoker areas, or who are otherwise regularly exposed to cigarette smoke. Other risk factors are also known. They are usually linked to a job that involves contact with toxic substances, exposure to asbestos, tar, arsenic, and so on. The incidences of lung cancer attributable to these factors are, however, well below that of smoking. A number of symptoms are associated with the development of lung cancer, even though they are not specific to cancer. A persistent cough, bloody sputum, difficulty breathing, weight loss and loss of appetite, chest pain, chronic infections such as repeated bouts of bronchitis. Giving up smoking, and better yet, not starting to smoke, remain far and away the most effective preventive measures in the fight against lung cancer. Once a tumour has developed, the treatment will depend on the type of cancer. Small cell cancers are very sensitive to chemotherapy. Radiotherapy may also be prescribed to treat localized forms of small cell cancer. Non-small cell cancers, for their part, are treated surgically first and foremost. The surgeon removes the affected lobe of the lung and, in rarer cases, the entire lung. If surgery is not possible and the cancer is in an advanced stage or has metastasized, the treatment involves radiotherapy and chemotherapy. Already involved in the treatment of lung cancer, thanks to products issued from its research and development, Sanofi Aventis is using some innovative new approaches to target most of the mechanisms involved in the growth and dissemination of cancer cells. In so doing, Sanofi Aventis is fulfilling its commitment to participate in the fight against cancer.